Welcome, everyone, and thank you so much for being here today. My name is Marianne Meed Ward. I am the Mayor of Burlington and Chair of Ontario's Big City Mayors Caucus. We are an organization of mayors of the 29 largest cities in Ontario, representing 70% of Ontarians. I want to thank some people who are joining me here today. My colleague Guthrie, who is the past chair of the Ontario Big City Mayors Caucus and the Mayor of Guelph. Dorothy, McCabe, a member of our caucus and Mayor of Waterloo. Colin, who's the president of the Association of Municipalities of Ontario, and Camille, the CEO of the Canadian Mental Health Association, Ontario Division. We are here to launch Ontario's Big City Mayors Solve the Crisis campaign. Ontario municipalities are struggling. We're struggling with an issue that we can't solve on our own. What is happening on our streets across this province is an unprecedented humanitarian crisis. There are too many people unhoused, living in encampments or other unsafe conditions, and they're struggling with mental health and addictions issues. The crisis is growing, and it impacts every single municipality across our province, large and small, rural and urban. It affects our residents, our businesses, and our local governments need solutions now. Together with various community partners, municipalities have been tackling this issue head-on, funding programs and spaces to find solutions. Although many of these programs have seen incredible successes, the need is far greater than what we can support. We need help. We can't do this alone. And in truth, this is not an issue that municipalities should be solving. But we have stepped up to do our part. So that's why we're launching today's Solve the Crisis campaign. We're asking governments to take action now. We must solve the homelessness, mental health, and addictions crisis that is unfolding in our cities. We're going to play a short video now as we launch the campaign. There is a humanitarian crisis unfolding in our streets, big cities, small cities, all across our province and across our country. People are struggling with mental health, addictions, homelessness, and we're seeing it in encampments in every community across this province. I'm Marianne Meed Ward, Chair of Ontario's Big City Mayors Caucus, of the 29 mayors of the largest cities in Ontario. Municipalities are stepping up. We know what works, and we're getting results. Like this facility here, I had the opportunity to tour with London Mayor Josh Morgan.
So I'm here at one of our supportive housing facilities, 44 units, part of the 140 we've created over the past year. This type of facility requires partnership of all levels of government. The chronically homeless in our city is a significant challenge because we do not have enough spaces to serve them within our shelter system or within the additional supports that the municipalities have brought on. So I've spent time going to encampments with our outreach teams to meet people face to face and talk about the challenges they're facing. And so I've met some of the 2,000 individuals who live unsheltered in our city. I've met many of them, and their needs range dramatically from just, I can't afford housing, to they need housing with significant supports, whether it be mental health and addiction supports or others, but just housing on its own isn't going to be enough.
Our mayors in municipalities across this province have stepped up with solutions in places like Kingston, London, Guelph, Kitchener, Waterloo. We know what works, but we can't do it alone. We need the provincial and federal governments to join with us with compassion and action, but we need your help. Add your name, say that you care and you want action. The time to act is now. Our video. This is a health issue, it's a housing issue, and it's a humanitarian issue. One that Ontario's Big City Mayors has been asking the federal and provincial governments to make a priority for several years. Through our advocacy on this, we have joined with other municipal organizations and community partners, such as AMO and CMHA, who are both here today with us, and others such as the Ontario Chamber of Commerce, the Ontario Association of Chiefs of Police, Ontario Business Improvement Area Associations, and the mayors and regional chairs of Ontario. We're calling on all levels of government for help. Both levels of government have answered the call with some funding and programs over the last year, but it's not consistent or enough. It's piecemeal. Taking on the homelessness crisis involves a whole-of-government approach that spans multiple ministries and multiple levels of government. We need one single-point person at the province to bring people together, to use the resources and the expertise to tackle this crisis right now. Our requests of the province are clear and will help us tackle this crisis together. First, appoint a responsible ministry and minister with the appropriate funding and powers as a single point of contact to address the full spectrum of housing needs, as well as mental health, addictions, and wraparound supports. Second, have this minister strike a task force with broad sector representatives, including municipalities, healthcare, first responders, community services, the business community, the housing sector, and the tourism industry to develop and implement a Made in Ontario action plan. Third, commit to funding the appropriate services these individuals need, community by community, where there are gaps in the system. Fourth, provide municipalities with the tools and resources to transition those folks living in encampments to more appropriate supports. And finally, invest in 24/7 community hubs or crisis centers to relieve pressure on hospital emergency centers and first responders. We're also calling on the public to join us in adding their voices to the Solve the Crisis campaign. We're asking residents to go to our website, solvethecrisis.ca, share your thoughts and experiences, and let government know that you want them to take action now. Together, we can solve the crisis and create better communities where all residents feel safe. Thank you once again for being here, and I will now hand it over to some of our municipal and community partners who are joining us here today to say a few words about their support for our campaign. First, I'd like to welcome Colin Best, President of the Association of Municipalities of Ontario, to the podium.
Thank you, Mayor Meed Ward. Good morning, everyone, and thank you so much for the opportunity to participate in this morning's event. Municipalities are the front lines of intersecting mental health, addictions, and homelessness crises. Homeless encampments and opioid deaths are occurring right across Ontario, in communities big and small, urban and rural, northern and southern. The more than 1,400 encampments across the province are a symptom of deeper system failures that hurt Ontario's social and economic prosperity. They are a result of a long-term underinvestment by successive provincial governments in key areas, including income security, deeply affordable housing, mental health, and addiction supports and services. There is an urgent need for clear provincial guidance on how municipalities should manage encampments and for federally led encampments response plan. Asking the courts to solve complex social problems is not the answer. While homeless encampments increase, the opioid crisis also continues to take devastating human, social, and economic tolls on communities. The opioid crisis is a complex problem and won't be solved by simple short-term solutions. AMO's calling on the province to implement a comprehensive response, including long-term sustainable and substantial investment in prevention programs, expanded access to evidence-based treatment, scaling up 24/7 crisis centers, and harm reduction supports available to those who need them. Local parks becoming homeless encampments and increasing numbers of opioid-related deaths across the province are not the best we can do for Ontario. In a place for as prosperous Ontario, we can solve big problems. It's time for provincial and federal governments to take the leadership role in finding the right solutions.
Thank you, Colin. I'd now like to welcome Camille, the CEO of the Canadian Mental Health Association Ontario Division, to say a few words.
Thank you very much to the Ontario Big City Mayors for your leadership and your advocacy. We are extremely proud to partner with you on these very significant issues. The community-based mental health and addiction sector is really uniquely situated to support the government and municipal partners to combat homelessness and keep people out of hospital emergency departments. In fact, our sector is essential to an efficient healthcare system. In just the past 2 years, 10 of our branches across Ontario diverted almost 18,000 individuals out of the emergency department. That gives you some sense of the importance of the work that my colleagues do. We are currently overwhelmed by the opioid crisis. Every single day, 7 people in Ontario die due to drug poisoning, and it's largely due to the toxic, unregulated drug supply. There are about 2,500 to 3,000 people who die annually as a result of opioid toxicity. So these are issues that my colleagues face every single day and are on the front line. We need currently, as it relates to housing, we need 100,000 units now to manage what is a wait list across Ontario. That's today. More than a decade ago, we called on government to provide 3,000 units annually at a cost of $30 million annually. Had that been met in 2015, we likely wouldn't be here today and we wouldn't be having these conversations. The homelessness and opioid issues did not happen overnight. However, we have fallen so far behind in addressing them that we need to come together, as we have, to talk about these in a manner that really invokes government to take action. So I'm here today with my colleagues, deeply proud of them and the work that they've done to raise this issue. I would not be doing my job if I didn't point out the fact that my colleagues are paid 20 to 30% less than other sectors who do similar work. And the result is that in areas where we've seen success, such as the Crisis Center at CMHA Thames Valley, we've just laid off staff. So we know there are solutions. We have the data that shows that they work. We were delighted to see the provincial government support a new crisis center at CMHA York Region South Simcoe. Unfortunately, it needs to be scaled excessively across Ontario. There are many, many locations where these centers should exist. I was recently in northeastern Ontario looking at the shelters that my colleagues work at, meeting people that need those shelters. The need is very real, and unfortunately, it far surpasses what we're able to provide. And we're just very deeply proud to partner and to work towards solutions with our municipal colleagues here today. Thank you.
Thank you. I'm going to now turn the podium to Dorothy McCabe, the Mayor of Waterloo.
Thanks very much. And my comments will be brief, but certainly appreciate Camille's comments and my colleague, Marianne Meed Ward, the chair of our OBCM. And of course, we appreciate, of course, working in partnership with the Association of Municipalities of Ontario. I'm here both as the mayor of the city of Waterloo, but also as a regional councillor for the region of Waterloo. And in our region, we have put a tremendous amount of money from our property tax system into working to address what we call a plan to end chronic homelessness. And the fact of the matter, in addition to what our colleagues shared here today, is that these are issues that the property tax system was never set up to address. Right? This is not what this program was set up to address. It's a 19th century model. So we have poured millions of dollars in our region into addressing this, and we're taking it off the backs of our local residents and our local citizens. And we're, again, as my colleagues have said here, there are solutions. We are finding solutions. We're implementing a number of solutions in our communities, but it needs to be scaled, and we need the support of the provincial government. We need the support of the federal government, because these are not programs that we can afford to run. We can manage the programs really well, but we need them there as funding partners. And I would also just like to underscore that as big as these numbers are, particularly for women, these numbers are very much underreported. In the work and research that our staff have done in the region of Waterloo, again through the Plan to End Chronic Homelessness, we know that there's particularly for women and people who identify as women, that there's a significant underreporting of the numbers in that sector, and we know that as much as the need is great for people across the board, particularly for women and sometimes women with children, the need is far greater than the numbers currently state. So that's something that I want to underline as well, that we need to be aware of and think about as well. So again, I'm here to just echo what Chair Marianne Meed Ward from Ontario Big City Mayors has stated, what Colin Best from AMO has stated, and Camille Quenneville from CMHA has shared, and to say that this is a crisis. We're working hard to address it, but we need provincial and federal government support to really to address this and resolve this for citizens across our communities. So thank you.
Thank you. And lastly, I would like to invite my colleague and the past chair of Ontario's Big City Mayors Caucus, Mayor Guthrie from Guelph, to give some closing remarks before we take some questions. Cam has been a champion of this cause for many years and has been doing some great work to address this issue in Guelph.
Well, great. Thank you so much. And I will just echo everything that's been said in front of me here before I have this opportunity. But what's happening is clearly it's not enough. And we have been raising this issue over and over again for so many years, especially when it comes to permanent funding that's known, that has certainty wrapped behind it. Piecemeal type of funding that comes from either the province or the federal government does not help with the long-term stable planning that our municipalities need. So as much as we are thankful for some of the funding that has come, and we can't ignore that, and we are thankful for that, it's not enough, number one, and number two, it's not sustainable because we don't know if we're going to get something from one year to the next. This is not the way that we have to address this issue. So amongst the things that we're experiencing in all of our cities, and when I talk about what's happening in Guelph, this could be said for any city, big, small, medium, across our whole province. We have continual increases of the mental health and addiction crisis happening, even though solutions are trying to be found. The more and more people are having these issues and they're not getting solved. So it's a growing crisis. The humanitarian crisis, as our chair has just rightly said. We have intersections with people that are struggling with addictions and mental health happening within our public spaces, within our downtown cores, hurting our business sector, the ma and pa shops in our downtowns that are already struggling still from COVID, trying to repair their income stream, trying to get their businesses going, are now becoming social workers. This is not what our downtowns need. That's not what we should be having as intersections and frictions within our parks and other community spaces. These people need help, and the mayors and the municipalities are strongly behind helping, and we have. But now we really need the federal and the provincial government to step up with certainty for municipalities. That's what we need. And that's what the people that we care about the most, that are struggling the most in our communities, need. We cannot forget that it's actually all about them. And so if we can focus on that certainty, we can help them and help our communities thrive moving forward. So I just want to thank the chair and the leadership of Ontario Big City Mayors, AMO, Ontario Mental Health Association, and the growing coalition of other stakeholders that have become a part of this growing, coalition to bring this issue continually to the table, to the governments, because we don't want to be here. We shouldn't have to be here. We need the provincial and federal government to actually say, we're going to get a plan, we're going to appoint someone, and we will cheerlead that all day long. And the solution at the end of it is going to be healthy people and healthy communities. And that's what we're here for. So please, again, we ask everyone to go to Solve the Crisis campaign and show your support for the people and our communities. Thank you very much.
Thank you, Mayor. We will now open the floor for any questions.
So you've laid out quite a few clear asks of the provincial government, but I'm wondering if you could talk a little bit more about the specific things that you'd like to see from the feds.
We need them at the table because this is a Canadian issue, and what we know from the evidence is that a funding announcement is not an action plan. It helps the community that got that funding for the period of time they got that funding, but as you've heard earlier, it is not predictable, and we can't count on that. We can't plan for that. And when there's an investment made in a specific community, it's great, but it pulls folks from other communities to access those resources. And so the evidence also says that people are better served by supports in their very own community, where they can stay with people that they know in a familiar area. So that's why we need a comprehensive, not a piecemeal, not a you get this how much money, you get this money, you get this money. We're grateful for it. Don't get us wrong. We are happy to take anyone's money to help solve this issue and keep it off our property tax base, where it never should be in the first place. But a funding announcement is not an action plan. So we need everyone at the table, first of all, including the federal government, to look at the proposals we've made in the past. We've developed a comprehensive 5-point action plan in 2022. We met with Sylvia Jones and a number of other ministers, brought a group of folks much like this, AMO, hospital sector, police, business associations, and laid out some specific policy recommendations. The answers are there. The solutions are there. It's not a mystery about what works and what needs to be done. Right now, we just need that comprehensive action plan, so no community is left out. No community is having to absorb the crisis from a neighboring community because they were fortunate enough to get funding. This is a Canadian problem. Right now, we're focused on Ontario because that's where we all live and that's what we can influence the most.
What do you think might happen if the government don't step on? Do you think what will be the future if the government decide not to listen to you, basically?
More people will die in our streets unnecessarily. People won't feel safe going to our parks. They won't feel safe going to our downtown business areas. Businesses will close. This is a humanitarian crisis, and it needs to be approached with that level of seriousness and that comprehensive level of planning.
Of the recommendations that you had already provided to Sylvia Jones, have any of them been implemented?
There have been some funding announcements, which we're very grateful for, and thank you for that. And we also want to note that Ontario, for the first time, this government did appoint a single person responsible for mental health and addictions. Of course, that's Minister Tobolo, and we're welcome. We're very grateful for that. But there needs to be a single person with resources, with staff that can coordinate. We had a conversation a couple of days ago with Minister Tobolo. There are something like 16 different ministries that touch this issue. So who's calling them all together? Who's deploying the resources from those ministries to develop a comprehensive action plan? And though he has the title, he doesn't have the ministry support and the staff and the funding. So that's a place to start.
Is that what's delaying moving forward with the comprehensive plans? Because some of these items we've been talking about, as you said, for years. So what has been that delay?
That would be a great question for our provincial and federal partners. We don't know, but we know what works. And you heard in the video about the situation in London. Their evidence around what works is astounding. In one case, an individual had over 200 interactions with police in 1 year. 200. It went down to nothing, such that the police were wondering if this individual had died. And they were delighted to discover that not only was the individual alive and well, they were in supportive housing. That's 200 police visits that can be deployed to what police are hired to do. In another situation, over 300, one individual, over 300 visits to hospital, down to 2 or 3 in a year. The results are there. The evidence is there. The data is there around what works. And what's not there is a comprehensive plan and sufficient funding. So that's really what we're asking for.
Do you have an estimate of how much this actually costs the municipal tax base, and why do you feel that that's an inappropriate cost for the municipal tax base?
We're spending millions at the region. I can tell you at the region of Halton, collectively with all of our social services, so if you consider the wraparound supports as well as housing, assisted housing, supportive housing, we're subsidizing the province about $16 million a year. And to give you an idea of what that is on the tax base, that's about 4 or 5% every year that we're subsidizing the province. The province has the resources. Property tax is a very regressive tax. It's not based on income. It's not based on economic development. And so it wasn't what property taxes were intended for. So we are doing everything we can. And I think that's the important part that we wanted to drive home, that even though this isn't our responsibility, even though we don't have the resources. We are still investing in this because our people are dying in our streets. Our people feel unsafe in our streets, and we know what the solutions are. So we're going to do what we can. And we feel we're leading by example. We're showing what works by putting our money where our mouth is, and now we need the partners to fund that, not just in one municipality here and one municipality there, comprehensively across Ontario, but more importantly, across the country. This is a national problem.
The answer to this question might be evident by the fact that you guys are here, but what have you heard from the Ford government in terms of the idea of creating a singular ministry to deal with this issue that currently is housed in 16 different ministries?
We, again, that's a good question for them. So we're launching our campaign today. We're not going to stop asking for that. We did ask for it 2 years ago, and now we're just trying to raise awareness and continue to say we believe that this is a path. If they have a different solution that's going to solve it, we're all ears, but we believe that this is the right way forward.
Right, but typically going public is the last step in whatever campaign that you have, because you all have access, I assume, to the Premier's cell phone, right?
He's calling me now.
Is there any, has there been any movement, has there been any suggestion that or indication from them that they're open to the idea of creating a standalone ministry to deal with these issues?
I think they're looking at what exists now with Minister Tabolo. They're looking at what the ministries do. And I know that they collaborate. I know, of course, the ministries talk to each other. But one ministry doesn't have the power to direct another ministry. So unless the Premier is going to take care of this, he needs to appoint a single person who can give that direction. So give that authority and give that ability to make those funding decisions across the province. Again, not piecemeal. I mean, we're grateful for the funding that's been announced, and we see that as a sign of progress since our last visit with them and our multiple asks over the years. There have been increases in funding, but it is not how we can solve this crisis. A little bit of money here and there, and no municipalities know if they're getting it. You can't plan for that. You can't say we're going to do this multi-million-dollar supportive housing, not knowing if the funding is going to be there from any level of government and not knowing if the programming funds and the wraparound supports are going to be there. You simply can't plan for that. So we need that action plan, that certainty. We're okay with looking at where's the greatest need right now, and let's develop a plan for the entire province and prioritize based on the need. We're not going to solve this overnight. This was years in the making, but we can solve it much faster than we have.
I'm wondering where this ranks in issues that you guys are hoping to address at AMO.
This is our number one issue for Ontario's big city mayors. Yes, it is a top issue for Association of Municipalities of Ontario, I know, because it affects all of us in many different ways. And there is no reason why anyone should be dying in the streets of this country, given the wealth and the resources and the expertise that we have. The answers are there. The people have come to the table and said this is a priority. We want to help. We're one of those partners. The province has been a partner with us. We want to thank them for what they've done so far. Same with the federal government. It is simply not sufficient to address the growing crisis. The issue is growing faster than the solutions being deployed to meet it.
Is there a cost estimate for what it would take to address all of these issues? I mean, I know you said in your region it's $16 million, which, you know, in terms of a provincial budget isn't a lot of money at all.
Right.
Are we talking about hundreds of millions? Are we talking about the low billions? Is there an estimate in terms of how much it would take to address these issues?
I don't have that. I don't know if AMO does. But what I will say is this, that if we deploy the right resource at the right place, we will save money. Think about those two examples that I gave you around 200 police interactions, 300 hospital visits. A single hospital visit, if you need an overnight stay, can be thousands of dollars. Times one individual, times 300 visits. In London, they brought hospital emergency visits for mental health calls down by 74%. So what you save by deploying resources to the appropriate preventive action will actually, in the long run, save you money for healthcare, first responders, for all of the issues that are now being enforced at encampments where people themselves living there are living in unsafe situations. So we're dealing with this issue right now through police and through hospital emergency rooms. It is exactly the wrong approach, and it's the most expensive way to deal with this.
How much of an issue has it become that this fight between governments on how to deal with people who have addictions, like this safe supply issue?
So that is, certainly there are different perspectives on that. We just want people that are, first of all, able and willing to get treatment to have a bed. We don't even have that right now, where people who are willing to get treatment can get the treatment that they need and then transition from an overnight emergency shelter to supportive housing, transitional housing, to eventually long-term permanent housing. And, we have seen that in communities where they have that full continuum, we have seen people go from living on the streets to being in permanent housing with the wraparound supports that they need. So there are people that want to get that help. Let's help them as a start, because we're not right now.
Can I just add?
Yeah, go ahead.
Sorry, just wanted to add one of the things that when in the region of Waterloo, when we have this plan to end chronic homelessness, and the research and study that we did with people with lived experience, and Camille probably can speak to this better than I can, but the statistics that we uncovered when we started to do the outreach to our community was really about the cost of people who end up homeless and the addictions they develop then. Mm-hmm. There are so many people out there who don't have an addictions issue already, but they end up homeless for one reason or the other. There could be as many stories as there are individuals, but because then they're on the street, they develop both often a drug addiction. In some cases, a single mom had told us that she developed an addiction to meth because she had to stay up all night to guard her kids because she had no place safe to go, right? So she developed an addiction, and then that addiction becomes a brain injury. Like the amount of brain injuries and things of that nature that develop once you become homeless. So I think really this solved the crisis strategy, and what Mayor Meed Ward has been talking about and others we're talking about is that we can prevent these human tragedies. Like that's really what this is all about, preventing those kind of human tragedies. And people, you fall into homelessness one reason or the other, if there's a way to first stop that. But then certainly once somebody is in danger of becoming homeless or on the street, they need help, and they need it right away before. Like within 3 weeks, people have the studies that we've done have shown that often there's an addiction that develops once they're homeless. It often doesn't start with an addiction. Not saying, sometimes that's the case too, but this is also what we've found. So it makes it that much more important why preventing the homelessness piece is so critically important.
While you are here, I have a quick question for you related-ish to that issue. My colleague want to know, a number of community advocates have written an open letter asking for women-specific emergency homeless shelter spaces, as there are currently none in your region. The situation is particularly dire in your region, according to them, and they are asking for immediate change. What will your region do to remedy the situation?
Yeah, so thanks for the question. We're working with the YWCA quite closely as a region. They've come up with a new model that they want to develop across the region. We've had one shelter dedicated to women that we've recently just purchased as a region, and the idea that the YWCA has now is disperse the housing across our community rather than centralizing it. So that's something we're working really closely with the YWCA and some of the community partners with currently. We know, as I said earlier, that we don't know the numbers for women as well as we do for other, particularly for men, single men, because they're coming into the shelters. We know that the numbers for women are drastically underreported and hidden, if you will. So that is an issue that we're working on quite closely. And again, it's part of through the plan to end chronic homelessness, something that we're going to work. We're continuing to work with the YWCA on to, first of all, we need to find some suitable land, to find places to build some new shelters. But no, we know that it's a critical issue in our community, absolutely.
Mayor McCabe, also while you're still up there, I'm wondering if you could talk a little bit about why it's so hard to estimate numbers around homelessness, and particularly for women, as you mentioned.
Well, I don't think, I mean, the homelessness in general, I think a lot of the reporting and we know the people who are coming in and out of the shelters, right? So we can pick up that kind of data. But for women particularly, a lot of them are unfortunately, they're either unsafe in the shelters, so they're not coming there, so then they're not counted. I mean, that's a really simple example, but there's a lot of women who stay in abusive relationships or who are couch surfing or who are, it's hidden. So they're staying in some very unsafe situations rather than coming to shelters because, particularly in our community, the single or shelters for women only, we need to build more of them. They often don't exist in many communities. So the women just are hidden. And so if we don't see them, we can't count them.
Separate but related, I'm wondering if any of you have been consulted by the province on their definition of attainable housing.
Maybe hand that back to
yes, we have. But before we go to that, I want to bring in Colin Best, who wanted to speak to the difficulty of collecting the data. Go ahead.
Thank you, Mayor Meed Ward. To answer the question, is one of the problems that we have is collecting that data, and it's one thing that AMO is advocating now, and also at a conference in 2 weeks' time, is we need a social and economic prosperity review so we can analyze these numbers and handle them, because you've got numerous issues at play here. Not only this situation we have homelessness, addiction, and mental health, but also we've got family abuse, we've got marriage breakups. We've also got the loss of productivity here. That you've got people and what people don't realize is there's been studies stating that 63% of homeless people are still working. They just can't afford a place to live. Now, if we could turn that into a productive situation, like we're trying in other locations, that would make it better not only for them, but also the economy. We have a labor shortage right now. If we could turn the people out of homelessness and out of these addictions, we could actually get more productive people and a better society. So that's one thing we're asking the province for, as well as the federal government.
With respect to attainable housing, the provincial government has not only consulted Ontario's Big City Mayors Caucus and AMO, but they have done broad outreach in the province around that. And our advice, which they did take, was not just to look at the average income of a community, and because in some communities, I'll say Burlington as an example, has a very high average income. So our attainable level is going to be higher than in other municipalities, but still very unattainable for people like my kids who are young adults. So there is an income test, but it's different from the average income, and that was something that we advocated for. That being said, the attainable housing piece is one part of that continuum, but the dire needs that we're talking about really require government-assisted housing and of many different forms.
Can I ask one more follow-up on safe consumption? I'm wondering if funding for supervised consumption sites is a part of this campaign or this more comprehensive plan, as we're talking about the opioid crisis and people dying now. It's great to look at prevention, but people are dying now. Do we need to take greater action to get that funding, and what's the timeline?
So the funding that we're asking for is for housing and wraparound supports. One of the reasons we've asked for an action table is that there are people that are much smarter than I am and very involved in this, and I would say our friends from the mental health associations, police associations, medical associations. There are resources to show what works and what doesn't work. And so that action table is the place to have those kinds of conversations and debates around what part of this what part of the solution would be gained by that. But overall, we want to stay laser focused on the fact that people are living in our streets and they're dying in our streets, and it doesn't have to be this way. And it is mental health, it is addictions. There are many different ways to provide wraparound supports, and it will be different in every single community. But the magnitude of the need, the piecemeal nature, the allocation-based funding, as Colin mentioned, this is part of a larger discussion around a need for a municipal fiscal economic review. Because as long as municipalities are required to wait for a funding announcement or allocation program to open, hope that you qualify, hope that your application will get across the finish line, wonder if you're going to get what you asked for or some percentage of that. That is not a way to solve a crisis. Any crisis, pick one that we're facing. That is not how to run a country. It's not how to run a province. And it's how we in Canada have been doing it for decades, if not since the beginning. I mean, the municipal framework has been around 100 years, something like that. The needs, the challenges, the complexities of our communities have changed dramatically in that time, but the funding arrangement has not. So as part of our ask, not only an action plan that solves this comprehensively, but looks at the root causes of why it is happening at all. And it shouldn't be happening in any community, but if we had the resources, if we had a different relationship with the federal and provincial governments, we know the answers. We can deploy the funds. But what we can't do is predict when we're going to get an announcement, when a funding envelope's going to open, are we going to qualify, are we going to get the money we asked for? And it is very difficult for us to plan the kind of infrastructure that's required. This takes, in many cases, years. You're building new facilities. You're trying to staff those up. It doesn't happen overnight, and it doesn't happen, on a hope and a prayer, which is what the allocation system is right now. We're thankful for the money, but it is not a way to run a province. All right. Any other questions? Yeah? Okay.
Great.
Thank you so much for joining this morning.